Two young children are found dead in their own home.
The scene was atrocious. That's the worst house that I've ever been in.
Police theories run from carbon monoxide poisoning to accidental overdose. But Dr. G's shocking findings threatened to turn a community upside down.
It was very worrisome right from the beginning that I was going to be dealing with something very odd here.
Then, a 25-year-old pregnant mother of two dies within a week of checking into a homeless shelter. Can Dr. G wade through a long history of abuse and poor health to discover what killed this woman so suddenly?
Unbelievable. This is abnormal.
Altered lives, baffling medical mysteries, shocking revelations. These are the everyday cases of Dr. G, medical examiner. It's part of Dr. G's job to remain objective, to get the facts and uncover the truth. But sometimes her findings are not what people want to hear, especially when they point to the most unlikely of suspects. On January 6, 1995, a panicked call comes into San Antonio's 911 operator. A man named Rick tells them that he's with a baby who's turning blue. First on the scene are the paramedics, who find the tiny body of 5-month-old Timothy Gutierrez on a couch. He isn't just blue, he's dead. They note that rigor mortis is already setting in. Sergeant David Evans is one of the first police officers to arrive on the scene.
The scene was atrocious. That's the worst house that I've ever been in. There were toys, there were clothes, it was dirty. There was food everywhere, and it stank. I mean, it smelled like there was just trash in the house. It was pitiful. So we had to focus in and try and stay focused on what we were there to do, which was to investigate this death.
Police soon learned that the property is home to several members of two different families.
We soon found out that there were 8 children and 4 adults living in this one house.
Emergency personnel on the scene are alarmed by their findings, but the situation is even worse than they imagined. Just as the police begin their investigation on the infant, the man who called 911, Rick, informs them that there is yet another body in a back bedroom. There, lying on a mattress, is a second dead child, Renee Alicia, Timothy's 2-year-old sister.
She's lying on her side and has vomited next to her.
Something in this house is killing children. A feverish hunt begins. Is it a poisoning, gas leak, or could they have overdosed on medication?
We notice there are some medicines, so our focus then becomes, is there an overdose on the children's medicine?
But after finding no obvious signs of trauma or assault on the children's bodies, detectives spot another more likely suspect: the house's heaters.
It's cold that day, so we're concerned that maybe there's a possibility of some type of carbon monoxide poisoning.
While emergency responders begin checking the house for carbon monoxide, the bodies of the 2 dead children are transported to the county medical examiner's office. Dr. G gets the call.
Initially, I was on call. I got a call from my investigator that we had 2 children dead in a house, and they were worried it was carbon monoxide.
But from the circumstances, Dr. G is already skeptical about the carbon monoxide theory.
There's a boyfriend in the house that didn't seem to have symptoms, and there was another caregiver in the house, a 12-year-old girl. One of the children didn't seem to have symptoms.
When Dr. G gets her first look at the 2 children, her suspicions are confirmed. They are obviously not victims of carbon monoxide poisoning.
As soon as I saw them in the morgue, they had no evidence of carbon monoxide. Carbon monoxide deaths tend to have a real cherry pink lividity. Very common for me to see that from the other side of the room, and that neither one of these children had that.
After death, blood stops circulating and succumbs to gravity, pooling at the dead body's lowest point. Normally, the pooled blood will appear as purple or maroon on the skin, much like the color of a bruise. But when blood has been tainted by carbon monoxide, the lividity will appear bright pink. The normal lividity of the two children tells Dr. G that whatever killed them, it definitely was not carbon monoxide. The lividity of baby Timothy also tells Dr. G something else: how long the infant had likely been dead.
Baby had anterior lividity. It had been dead for a while. The lividity, or where the blood pools, was fixed on the face.
The fixed lividity indicates to Dr. G that the baby was dead for a period of time, possibly several hours, before EMS arrived. But as she continues the autopsy, the possible time of death seems to be the only thing Dr. G can determine for sure.
Found absolutely nothing. No trauma, no natural disease, nothing.
There was nothing significant on Timothy that was found.
It was very worrisome right from the beginning that I was going to be dealing with something very odd here.
The infant's body fluids are sampled and sent to the toxicology lab for testing, but the results come back negative for any lethal substances. Under different circumstances, this case may have been diagnosed as SIDS, sudden infant death syndrome. More of a phenomenon than a medical condition, SIDS is a diagnosis of last resort, one that is made when a complete autopsy, examination of the death scene, and review of the infant's clinical history reveals no other rational explanation.
On babies, we sometimes see that, and those are called sudden infant death syndrome if the circumstances are right.
But SIDS only affects children in the first year of life, so it's not a possibility in the death of Renee Alicia.
2-year-olds are very uncommon to die. You're past the infant death stage, and yet you're not dying usually unless it's an accident, a car accident, or drowning accident. So it's a very uncommon age for us to see.
At first glance, Dr. G finds no trauma on Renee Alicia's body, but telltale signs of a difficult life are evident.
She was very unkept. She had the worst set of head lice I have ever seen in my life. It was just swarming in her hair.
Initially, Dr. G sees nothing to suggest how this 2-year-old may have died.
That's all I found. No natural disease, not well cared for with the head lice and just kind of overall disheveled look to her.
But Dr. G's exam has just begun. A 5-month-old baby and his 2-year-old sister have died under mysterious circumstance. Police have a host of possible culprits: carbon monoxide, overdose, SIDS. But all of the theories are about to be thrown out when Dr. G makes one startling discovery. As part of every autopsy, Dr. G examines the inside of the mouth to check for obstructions or other clues. When she opens the mouth of 2-year-old Renee Alicia, this mysterious death instantly becomes a homicide case.
What I saw were the impressions of her teeth abrading the inner aspect of her lips. Not a bite mark, mind you. It's hard to bite the inner aspect of your lip. They were impressions as if somebody had pressed something, a hand or a pillow, against that mouth to suffocate her.
From the outside, there are often no markings to confirm suffocation. But pressure on the top of the mouth from a hand or pillow would create a linear abrasion from the lower edge of the teeth, marking the inside of the upper lip.
Turned to the detective and said, "This is a homicide. Unless you can tell me somebody did CPR on this child." And they said, "No, nobody touched this child. Nobody did CPR."
She immediately told me this child had been suffocated because of those impressions. So she was able to find that and determine and rule homicide in that death.
What's more, Dr. G is immediately convinced that the baby Timothy was also smothered, even though she found no teeth marks during his autopsy.
Now this baby doesn't have any teeth, so it's very easy to suffocate it with no marks. So I said most likely both of these are going to be homicide. We know the 2-year-old definitively is. By inference, the second one is.
We've got someone that has suffocated at least one child, probably another, since we have 2 dead infants at the same time. And so the focus of the investigation at that time is who was the last one with the child.
See, so far
With Dr. G's findings on hand, police are now on the hunt for a killer. Their chief suspects, the 4 adults who live in the house where the dead children were discovered. Topping the list, the victim's own mother, Mary. Incredibly, she'd already lost a baby under mysterious and strikingly similar circumstances 5 years earlier.
It appeared that it was some type of pneumonia that the child died from, and it was undetermined whether or not the child died of the pneumonia or SIDS. It was really an undetermined death. If parents have one child die of SIDS, then it's a sad occurrence. But then when they start having other children die of SIDS, then you need to look further into that, because that usually means there's some sort of foul play involved.
And despite initial suspicions in this case, Mary has a rock-solid alibi. A neighbor recalled hearing 2-year-old Renee Alicia cry at the time the mother was leaving the house. So Renee Alicia was apparently alive the last time Mary was with her. For police, what at first seemed like a pattern of murder becomes only a cruel coincidence. Next, police focus their attention on Mary's boyfriend, Rick, the only adult present when the children died. He also discovered the bodies and called 911. His alibi at first seems unbelievable.
He just simply said he didn't know what happened. He was sitting there watching TV.
Police are not buying his explanation. But then they talk to a 12-year-old child, Victoria. She is the daughter of the other family that lives in the house. She confirms Rick's story.
When we'd bring up anybody else's name, she said, I was the one that was in charge of the kids. It was my responsibility. I was the last one with them.
Victoria did make a statement that she was the one responsible for taking Alicia back to the bedroom and putting her to sleep, and that she was the one with access to Timothy.
The 12-year-old goes on to tell police about her somewhat unusual role in the household.
Many times she was the primary caretaker. If one of the other children had a disciplinary problem, if they did something wrong, then Victoria was disciplined for not taking care of it. She was in charge of those kids, and if the other kids messed up, then Victoria got punished because the other kids messed up. And it was just a sad situation overall.
Everybody described it as a dysfunctional home. There was a lot of neglect of all the children, including Victoria.
She had a very kind of dismal view of life and the people around her.
With all the adults in the house providing solid alibis, police turn their attention to 12-year-old Victoria, a girl who many consider to be a victim of neglect herself.
To me, it seemed that their primary focus was always on Victoria. They just seemed to target her.
I don't think the police actually ever suspected anybody else. I think that was a problem in the case. Once the police put their eye on somebody, they really get blinders.
But from Dr. G's perspective, it's the how, not the who, that concerns her.
I felt strongly that someone killed the 2-year-old without a doubt. I don't know if it's Victoria. That's not my job. It's the police job and the prosecutor's job to figure out who did it.
San Antonio police question their chief suspect, Victoria Dalton, without her mother or a lawyer present.
I think it was 6 hours, and it was quite a long time. She was not allowed to leave the room. I remember this is a child that had never been in trouble before, never had any kind of problems with the law.
Victoria had not even been to the principal's office, really, in her school, so she had never been questioned by authorities or anybody in in a position to intimidate her, and she was there by herself. The mom was not in the room.
You know, she was confused, she was distraught, and it was quite traumatic.
After 6 hours of questioning, Victoria admits that she suffocated Renee Alicia, but she insists it was an accident.
She suffocated the 2-year-old. She used a pillow. The pillow was found next to her when you look at the scene pictures.
But once Victoria has legal representation, she soon recants much of what came out in her 6-hour interrogation and claims that she is innocent of the murders. When the public learns that the police suspect a 12-year-old girl for the murders, many in the community become incensed.
This is one of the very first cases where you had a child of 12 accused of a double murder. And so it really stirred a lot of emotion. There were candlelight vigils. She was getting all kinds of letters of support.
She was so young, and people didn't want to believe that this child could have done these two heinous acts. And so that easily fed into people wanting to believe that she was innocent and wanting to support her.
Public opinion was that they forced that confession out of her. They had the wrong person. They were sure that she was not the person that killed these children.
With tensions high in the household where their children died, Victoria leaves and moves in with her grandmother miles from San Antonio. Meanwhile, police continue their homicide investigation.
The thinking at that time was to let her go home. We'll continue with the investigation, and we will just present this to the district attorney and let them proceed with the case at that time.
But then, investigators get a disturbing phone call from Victoria's grandmother about her dog. It seems it's dead.
The grandmother saw Victoria playing with the dog's throat and asked Victoria what she was doing. And Victoria replied, "Well, I'm just looking for some lumps on this dog's throat." And then several hours later, she asked Victoria, "Where's the dog?" And Victoria said, "Well, I don't know." And so, amazingly, they looked in the living room and found the dog wrapped in blankets, and the dog was deceased. So at that time, the grandmother said, "I don't want Victoria around the house anymore."
A little bit, too much to go without concern, even to the grandmother. So the grandmother notified the detectives of this fact, and the detectives notified me.
Proving that Victoria strangled the dog may be a critical link in establishing a deadly pattern of behavior, but the grandmother's story won't be enough. Dr. G has ruled the death of 2 small children homicides, and police have put a 12-year-old girl, Victoria Dalton, at the top of their list of suspects. But a challenged confession, attained without the girl's lawyer or parents present, is their only evidence, until police receive a strange call from Victoria's grandmother claiming that Victoria has just killed her poodle. Now, the fate of a 12-year-old girl charged with a double murder hangs in the balance as Dr. G attempts to discover what or whom killed the family dog.
This is the first time that I'd ever heard of an autopsy being performed on an animal to see that it had been murdered in any way.
I am no poodle expert. So I found 2 experts in veterinary medicine. One was a veterinary pathologist and one was a veterinary radiologist, and we all performed the autopsy together.
And it won't be easy. Dog anatomy differs greatly from that of humans. Dr. G's objective? To determine whether the dog died of natural disease or of trauma.
Part of the autopsy is to show the negatives, the fact that there's nothing else wrong.
Ruling out natural causes will add considerable weight to the authorities' contention that the dog's death is part of an ongoing pattern of violence.
We found no evidence of any natural disease. Dog internally, although it was 11 years old, had nothing wrong with it. Had some hot dogs and aluminum foil in its stomach, but other than that, nothing wrong with it.
Nothing wrong until they inspect the canine's mouth. Dr. G sees a minor but possibly telltale injury.
The extent of the injury on the poodle, which suggested the suffocation, was a cut to the tongue. Those injuries were very similar to Alicia's injuries, which led Dr. G's opinion and cause of death to be suffocation because of internal injuries and external on her upper and lower lip.
The dog was suffocated. The dog had been suffocated in a similar fashion to Timothy and Renee Alicia.
And so we had a remarkable, very incredible coincidence between the two.
After the incident with the dog, prosecutors feel that even at 12 years old, Victoria could pose a danger to those around her. She is arrested on the charge of the double murder.
She was arrested on a warrant, charged with capital murder. And obviously she was detained in the juvenile detention facility here in San Antonio.
A little dog died, and they were trying to even say that Victoria had something to do with that.
Many of the citizens of San Antonio remain convinced of her innocence.
There was a strong bias for Victoria without knowing a lot of the facts. Somehow they've got the wrong person or my findings were wrong. And, I just can't, to me, I have to ignore that part. I can only go with the facts that I have with my investigation of what I've done.
Medical examiners, there's a perception that they are there to work for the state. They may be paid by the county, but their opinions are not paid and bought for.
Victoria Dalton's capital murder trial opens in October 1995. For the prosecution, the task is daunting. How to convince a jury that a 12-year-old child is a murderer without any eyewitnesses and no clear motive.
Why would a 12-year-old girl kill Alicia? And then to go back and literally hold her hand on the back of the head of an infant and hold him down into the couch sufficiently long enough to suffocate his little body and to leave him laying there still.
But the one thing that the prosecution does have is the testimony of Dr. G. It will be the most crucial part of the state's case against Victoria.
When you're talking about shooting cases, infant deaths, the kinds of cases, is it an accident? Is this accidental? Is this intentional? What are the other circumstances? It's not always just about that cause of death. It's all the surrounding circumstances. It's the forensics of it that are intriguing and that they're called upon to offer their opinion and their investigation.
Her testimony was vital. It was an integral part of the case.
On the stand, Dr. G explains the complexities of her conclusions and why, in her opinion, both children were suffocated.
We have a clear evidence that this one was a homicide, the 2-year-old with the marks on the inside of the lips. But I didn't have any marks on this baby. There's no reason for the baby to be dead. I don't think I can't call it a SIDS because I have the 2-year-old dead at the same time. And so these two are both homicides. And because it is so easy to suffocate that baby without leaving a mark. And I clearly have one of them already suffocated. It's kind of hard to get that over to the jury.
This is a case where we needed desperately to have a jury understand. The medical examiner's testimony is critical.
The courtroom listens to Dr. G with rapt attention, especially Victoria.
She was the most intense defendant at the trial I have ever witnessed. She hung on to every word I said. She was just looking at me and was fascinated by what I was saying.
After 3 weeks of grueling testimony, the case goes to the jury. They are left to consider the prosecution's chilling account and decide whether Dr. G's testimony proves that Victoria suffocated the children or not. It takes the jury only 5 hours. Victoria is found guilty of capital murder.
I went ahead and convicted her.
She was found guilty.
I think the most remarkable part of this case is that a jury was able to, after weeks of testimony, decide on her guilt, that she had committed the capital murder within hours.
Although the jury finds Victoria guilty of a capital crime, they give her a compassionate sentence, 14 years, out of the maximum of 40. Victoria is sent to the care of the Texas Youth Commission, and there she served her sentence until 2002, when she was released into a transitional home. During her incarceration, Victoria admitted that she had killed both Timothy and Renee Alicia and expressed deep remorse. She is now on her own, trying to put her childhood behind her.
She is the type person, she's going to make the best out of it, and I think she has.
If Dr. G hadn't uncovered the subtle sign of suffocation indicated by the impression of Renee Alicia's teeth and made the connection between that death and the murder of her grandmother's dog, the murders might have gone unpunished. It took an objective eye for Dr. G to get to the truth, no matter how inconceivable.
Had Dr. Garavaglia not ruled homicide, we wouldn't have had a case.
Dr. G, she's just an extremely valuable resource to have.
Every death that passes through the Orange County Medical Examiner's office has a story to tell about the life that was lived. A life shortened by illness. A life lived long and well. A life whose death might have been prevented. For Dr. G, it's those deaths that could have been prevented that are in some ways the most tragic, such as the case of Veronica Murphy. 25-year-old Veronica Murphy has fallen on hard times. She's just ended a reportedly abusive relationship, has been evicted from her apartment, and is desperately looking for a new start. She turns to a local Orlando homeless shelter for assistance.
The resident came through our intake process indicating that she was fleeing a domestic violence situation and was unable to secure residency with any family or friends.
She was crying, like begging my cousin, please take me to the shelter, please take me. Cousin said, why you wanna go? She said, that's the only way I'm gonna get on my feet. I got to get on my feet. I can't live like this. And when I think about it, she made me think that maybe she just got tired of being a burden to people.
She arrives at the shelter with her two small children, one 6 years old and a 4-month-old infant. She tells the staff that she's expecting another baby in 7 months. She also informs them that she is suffering from ovarian cancer.
One day she just sat down and talked to me. She said, been to the doctor, they said the cancer is spreading and there's nothing that they can do about it.
In spite of these liabilities, the staff quickly learns that Veronica is a formidable woman, determined to put her troubles behind her and make life better for herself and for her children.
The resident was very aggressive in establishing her self-sufficiency. She identified her own goals and objectives, and she was very focused on fulfilling those goals.
It was make a fresh start, you know, like, because from my understanding, that was her whole point of moving to Orlando, to get on her feet.
But just 6 days after she arrives at the shelter, Veronica's world comes crashing down.
The early part of Saturday morning, her son came out of the room and he was tearful and saying that Mommy was ill, that she had a fever and that she was vomiting. Staff responded to the room to find at that time that she had lost consciousness. Paramedics were called. She regained consciousness during that time. At that time, paramedics determined she did need to be transported to the local hospital. She was very insistent that her children be taken care of, and she was reassuring to her children that Mommy would be okay and Mommy would be right back.
She couldn't have been more wrong. Before even arriving at the ER, Veronica is dead.
When she passed, the first thing came to my mind was the cancer.
Unfortunately, no one knows for sure what killed Veronica Murphy. her body is transferred to the Orange County morgue for answers. At the Orange County morgue, about 1 out of 15 bodies autopsied is classified as homeless. Homeless cases present special difficulties for a medical examiner. Because most homeless victims lack medical records, the search for the cause of death can be like looking for a needle in a haystack. But the case of Veronica Murphy is an exception. Though homeless, she does have medical records available for Dr. G to review.
Well, this morning we have a 25-year-old black woman who is short of breath, complaining of some back pain, and she's living at the Coalition for the Homeless. Now, there's this history that she has high blood pressure, and that she's 11 weeks pregnant, also that she has ovarian cancer. She's basically at the homeless shelter, and she falls to the floor and supposedly has some kind of seizure activity, but then she wakes up again and complains of shortness of breath. She's transported, her condition deteriorates, and they have to code her fairly quickly. She doesn't smoke, drink, or use drugs. She's not employed. Father's en route here. He lives out in California.
The records, however, are not complete and leave many questions about Veronica's health unanswered.
There is some sketchy information of what we had. There was some question about ovarian cancer, and we never quite could figure out where that came from. If she told somebody that, we really couldn't get that substantiated in the medical records.
She has a lot of problems that could have occurred with her. So we'll go ahead and get started on her and see why she died.
25-year-old Veronica Murphy dies while seeking shelter at a homeless facility with her 2 small children. Now Dr. G must figure out what killed her. Was it the ovarian cancer she mentioned to the shelter staff, or something yet to be uncovered? Waiting anxiously for Dr. G's opinion is Veronica's family.
It is so shocking. I would just love if the doctor could put it in writing, word for word, what she believed happened in the course of the last 5-6 months. I mean, you know, just looking at her body and looking at what she think, you know, or whatever, because I be honest, I know she's gone, but I still don't believe it.
Because Veronica Murphy reported that she was fleeing domestic violence when she arrived at the shelter, Dr. G will pay close attention to any signs of trauma from such abuse that may have led to her death.
Yes, 1, 2, 3. Okay. Pierced, double pierced on this side. Ooh, keloid.
But apart from pierced ears and a scar, there is no external sign of any abuse. But Dr. G does take note of Veronica's weight.
She is morbidly obese. She weighs about 340 pounds, a very big woman.
A person is characterized as morbidly obese if they weigh more than double their ideal body weight, or if the person is more than 100 pounds overweight. Morbid obesity commonly leads to a catalog of dangerous medical problems, from strokes to high blood pressure to fatal heart attacks, and accounts for more than 300,000 premature deaths every year. But whether or not Veronica's weight had anything to do with her death remains unclear.
The preliminary reasons, there's a lot of different things we have to worry about. She's high blood pressure, she's just had a baby, plus she's pregnant again. Post-mortem cardiomyopathy, possibility, I guess, hypertension, maybe there's a bleed in her head. There's always a possibility of pulmonary embolus, blood clots. She's obese. She weighs over 300 pounds. That's certainly a risk factor.
With so many possibilities, determining how Veronica died will become a process of elimination for Dr. G, beginning with the internal exam. Using a Y incision to cut through the chest and abdominal cavity, Dr. G opens the body. Once the internal organs are exposed, she pursues the obvious first. Did Veronica die of the ovarian cancer she reported to the shelter staff? Ovarian cancer is considered curable, but very difficult to detect in its early stages. For a woman like Veronica, homeless and lacking consistent medical care, the cancer could have easily progressed to a deadly stage without any obvious signs. But when Dr. G examines Veronica's ovaries, she is surprised to find no signs of cancer.
And that ovary didn't look that bad. She has a little cyst, kind of a thick-walled cyst in her other ovary, but I wouldn't say that was cancerous.
It appears that Veronica's belief that she had cancer was unfounded.
She thought that she had ovarian cancer. Yes, and we didn't see any evidence of that.
With ovarian cancer discounted as the cause of Veronica's death, Dr. G turns next to confirm whether or not Veronica was pregnant when she died. According to Veronica's medical records, she was 11 weeks pregnant at the time of her death. To confirm this, Dr. G must carefully examine Veronica's womb. It is a delicate process.
The trick is to opening it up without breaking the amniotic sac. So what we're going to do is open up through the birth canal. Take a little peek.
Much like the external examination, Dr. G must inspect the fetus in the amniotic sac first to make sure nothing is amiss before she moves on to autopsy the fetus itself.
We opened up, trying to maintain the integrity of the amniotic sac, and the amniotic sac was maintained, and we could see the fetus inside the amniotic sac looked normally developed. It was about 2 inches long, and from that we can get a general estimate of the gestational age, and it matched what apparently she felt that her last period was when she'd gone to the hospital weeks earlier, that it was about 11 to 12 weeks gestational age.
She was 12 weeks. 12 weeks. And that would have been real stressful on her too, because she was already like weak.
Dr. G's examination of the fetus proves that Veronica became pregnant only 1 month after she gave birth to her youngest child, a 4-month-old infant. For Dr. G, this raises a red flag. When a woman is pregnant, her total blood volume may increase by as much as 45%, causing blood vessels to enlarge and engorge. Along with this increase in blood volume comes an increase in the danger of clotting as the body prepares for the loss of blood during labor.
Pregnancy is known to increase your estrogen level, and pregnancy makes you more prone to blood clotting because of the increased estrogen. Of course, birth control pills, some of the birth control pills, it's the same way.
And Veronica suffers from another major risk factor for blood clots, morbid obesity. But a killer clot can form anywhere in the body, causing a stroke in the brain, cardiac arrest in the heart, ischemic colitis in the colon, and many times a person doesn't even know they are in danger until it's too late.
We've seen it in people who have any type of broken bone. We've seen it in people with like long transcontinental airplane flights. People who spend 8 hours on the airplane in those lovely little cramped seats, and then come off the plane. They're checking into their hotel, and bam, they go down.
But until Dr. G can prove for sure what precisely killed Veronica Murphy, her death remains an unsolved case. "25-year-old Veronica Murphy is stricken without warning at a homeless shelter and dies en route to the hospital. ER doctors are at a loss as to what killed the young mother. And so far, Dr. G isn't sure either. But she does have her suspicions. Veronica suffered from 2 known risk factors for developing fatal blood clots: her morbid obesity and her rapid succession of pregnancies. For Dr. G, the hunt is on. She begins by inspecting Veronica's respiratory system, her heart and lungs. But the moment that Dr. G sees Veronica's heart, she wonders whether Veronica died of something other than a blood clot.
This is a huge heart.
Veronica's heart is more than double the size it should be.
This is abnormal. 750 grams. Her heart should be around 350 grams.
She had a massively enlarged heart.
An enlarged heart is often attributed to high blood pressure, known medically as hypertension. With high blood pressure, the heart must work harder to push the blood through constricted arteries and veins. And this never-ending workout causes the heart to grow like any muscle in the body. Only with the heart, unlike other muscles, bigger isn't necessarily better. An enlarged heart can place undue strain on the muscle and result in sudden cardiac death.
25 years old, we don't really see a 750-gram heart in that age group.
And size isn't the only problem with Veronica's heart.
Unbelievable.
Dr. G can see that the overworked muscle has obvious signs of trauma.
Yeah, look at that. She's got fibrosis in her heart. Look at that. Isn't that horrible? She's only like 20-something?
It's still uncommon for somebody so young. And hers had a lot of patchy fibrosis or scar tissue already in the heart.
The heart muscle has somehow been destroyed and it's been replaced by scar tissue.
For Dr. G, the finding of scar tissue in Veronica's already weakened heart means that it was an organ struggling under great duress. The question is, did her heart kill her?
I thought that's what she died from when I saw that heart.
With such an unhealthy heart, it is possible that Veronica Murphy could have suffered from a fatal heart attack. But regardless of the state of her heart, Dr. G's next finding is the key to the case.
She's got one of the causes of death where it's really quite obvious at autopsy. And even though she has the biggest heart I've seen probably this past few months, maybe this year, she died from pulmonary embolus.
As Dr. G suspected, Veronica Murphy died from the effects of blood clots, specifically pulmonary embolism, in the vessel leading to her lungs.
This is a blood clot, this is a blood clot, this is a blood clot.
Now that Dr. G has discovered the fatal blood clots, she is able to piece together the final chain of events in the death of Veronica Murphy. According to the medical evidence, when Veronica Murphy checks into the homeless shelter, she's suffering from a deadly combination of risk factors for developing blood clots. She's morbidly obese, is 11 weeks pregnant, and just gave birth to a child 4 months ago. At some point during the next few days, the blood flowing through the deep veins of Veronica's leg begins to pool and clot.
You know, when you're obese, you don't have the muscle that's actually kind of helping contract to bring the blood back. So the blood, there's more stasis or pooling of the blood when you're obese.
This syndrome, called deep vein thrombosis, may well have been occurring without any real discomfort.
I don't think she had really any symptoms that would have drawn her to seek medical attention prior to this event. We didn't hear anything about pains in her legs. We didn't hear anything about having intermittent shortness of breath or any type of chest pain. We didn't hear anything about that. So this was pretty quick for her.
On Veronica's 6th night in the shelter, the clock runs out. Several enormous clots break free in the deep veins of her legs. Her huge heart swiftly pumps them up into her heart and straight into the pulmonary arteries, where they begin to block the flow of blood.
As they're leaving the heart to get to the lungs, they're getting smaller and smaller and smaller. So they just get caught up.
Veronica begins to suffer hypoxia, lack of oxygen.
Her pulmonary artery was occluded with these blood clots. They couldn't get even through. And so going into both lungs are completely occluded. So neither lung's getting any blood, so that's incompatible with life.
She died of a bilateral pulmonary thromboembolus. So the bilateral, it's on both sides because it's occluding both lungs. Pulmonary, it's in the lungs. Thromboembolus is the thrombus is the blood clot. An embolus is anything that goes
free in your blood system and then lodges somewhere. So it's a blood clot that broke free and then lodged into her lungs. Even though that heart could have killed her at any time with an arrhythmia, the other thing, the blood clots trumped it, because the blood clots are incompatible with life when they get up to your pulmonary arteries like that, and no blood can get into your lungs, so nothing gets oxygenated. And so that is a cause of death that we know definitively why she died.
As she does with many cases, Dr. G calls Veronica Murphy's family to help them understand and to come to grips with their sudden loss.
She had blood clots in her leg that broke free and went to her lungs. The reasons for why a young woman would get blood clots like that, one of them is the risk factor is being overweight and obese like she was. The other problem is she's pregnant.
In the eyes of Dr. G, Veronica Murphy was a person whose premature death was sadly predictable and preventable.
It's sad that somebody passes on at a young age, but it's also sad to me that somebody at 25 can weigh 340 pounds. I mean, I don't know what was in her life that would make her like that. I know what brought her to the homeless, Coalition for the Homeless. Obviously there's something going on with her that's sad that I don't know about.
It's a story Dr. G reads all too often in the bodies that pass through the Orange County morgue.